Started. Are you good?
Yes.
Awesome. Awesome. Well, I wanted to thank you, first of all, so much from the bottom of us for even being here with us with your schedule. It really is an honor to talk to you. We have so much respect for what you are all doing on the front lines, and that we truly see you as heroes for what's going on in this crazy world of ours right now. And it's almost unimaginable to us as realtors to do what we're doing, knowing that you're doing what you're doing. And, I just wanted to ask you to talk with us to make it more real for all of us, and explain what the situation's been like for you, if you would, and then open it up to some questions some people may want to ask you. If you could start by telling us a little bit about your background, because I know you're a very accomplished nurse and you've been in a couple places.
Absolutely. I'm really so glad and appreciative of anybody who has any interest in hearing what any healthcare worker would want to say. Public speaking is not necessarily my strong suit, so forgive me if I'm a little nervous. But
You're doing great.
I feel like I'm representing my community right now, not only my community of people that I love and care about and work to keep safe, but also my community of healthcare workers who I really just words can't describe the level of gratitude I have to be able to be a part of the solution in some way of what's going on right now.
Sure.
As everybody is, honestly, we all are together in this, and that's kind of the central message that I think is the most important to communicate. But as far as my background, I'm a registered nurse. I have been a registered nurse for upwards of almost a decade now. I began my career on an inpatient surgical floor at a hospital in New Jersey. And then after about a year and change of that, I went to work at the Hospital for Special Surgery, which is a very specialized institution that primarily just focuses on orthopedic surgeries. And once I was there, I stepped into the role of a inpatient nurse. So that would be the nurse that takes care of people who are coming out of surgery, for example, with hip replacements, knee replacements, spine surgery, anything that has to do with the musculoskeletal system of the body. And after 3 years at the bedside on an inpatient unit, I transitioned into the role of a PACU nurse. So the PACU stands for the post-anesthesia care unit. And that's where patients come after surgery directly from the OR to recover from the anesthesia that they receive to keep them safe during the procedure. They spend typically 4 to 6, sometimes more hours as far as the time frame that they recover from that. And then they go to the inpatient floor once they're safely able to transition to that level of care. So at my hospital, the post-anesthesia care unit is considered the critical care area of the hospital. So when there are emergencies, we're the ones who respond with the anesthesiologists and with the medical attendings and the hospital administration to basically oversee a situation that's potentially dangerous for a patient. So I've been in that role for about 3 years. I did do a short amount of time at the HSS unit that opened up in Stanford Hospital earlier this fall. So I was there doing in a more pre-op and post-op role for a few months, and then I came back to the hospital for special surgery. So once COVID kind of came on the scene, so to speak, in a way that was tangible and real for all of us in New York City, which was several weeks ago, going on a couple months now. The Hospital for Special Surgery performs the vast majority of the surgeries that we do are elective, and we don't have an emergency room. So the patients that come to us are scheduled, and they're having procedures that are not necessarily, they're not life-threatening or immediate need for those. So what they asked of the providers in my role was that we self-select or volunteer to work at the emergency room in the sister institution that we have next door to us, New York Presbyterian, because their emergency department was overwhelmed by the volume of patients that were coming in with COVID symptoms. And that was just putting a strain on their resources, and they needed the extra help. So myself and several of my colleagues that work the night shift, because I primarily work nights, I've done all sorts of things, but mostly night shift, volunteered to do that, just responding to the need. for a limited time. So we worked there for about 3 weeks. So that was kind of my introduction to the reality of what COVID looks like.
Yeah.
In the emergency.
Was that Alessandra, like, when was that exactly? Like when it really first started to break in New York?
Yeah, so I want to say that I've been back in, and I'll explain like why I came back and what I'm doing now, but I came back about 3.5, 4 weeks ago. So I would say I was in the emergency department in the early part, well, let's see, now it's April. So from early to mid, sort of late March. So for those 3 weeks where kind of just as things were starting to really pick up in New York, and as New York was becoming the epicenter of the virus and of the disease within our national landscape, we had already seen the devastating effects of what this illness does in places like China and Italy. And it just sort of started becoming, it was clear that New York City was going to become the next area that was going to be the hotspot for the volume of cases that was going to be coming on to the healthcare system. Right. So that was for about 3 weeks.
Right.
That I was,
so can you tell us what that's been like? So you're back ICU now, right?
Right. So
what is that really like for those of us that have no clue?
So the ICU stands for intensive care unit. And in a typical hospital, the ICU is where they'll send, there are different specialties within ICUs, like cardiac ICU, surgical ICU, medical ICU. For the purposes of COVID right now, there are a lot of hospitals, my hospital included, special surgery, which don't have traditional ICUs, which have essentially created them to be able to care for patients who we need beds for, who need that high level of care. And so they essentially made an ICU in HSS literally in 2 days, to the best of their ability, to the best of our ability, and are staffing it with nurses from the PACU and from other specialties around the city that have come to work there. The ICU is a very specialized and high level of nursing care, medical care. These patients are extremely sick. So typically what you'll see in a COVID ICU is patients who are ventilated, which means they are not able to breathe on their own. So they are intubated, which means that there is a tube that's put into their airway to assist them with breathing. And then as a result of that, they require sedation, so that they are safely able to not, remove that ventilator, which is their lifeline, and that's breathing for them. And they also require supportive medications such as blood pressure stabilizing medications. So what you'll see is patients who have the ventilators and have 1, 2, sometimes more medications depending on how sick they are and what kind of toll the virus has taken on their body, needing those drips that will be preventing their blood pressure and from declining, and then all their other body systems from responding and declining. And then as well, they'll require sedation so that they're not, awake and alarmed and scared. And they're also require blood pressure medications to keep their vital signs stabilized. Then they'll require other types of treatments, whether it be blood products or antiviral medications. Most of these are given intravenously. They'll have several lines. So they'll have, usually not like just regular IVs like you would see on a typical hospital floor, but central lines in their necks or in their arteries. And then they'll also, require pain medications or sedative medications that'll keep them comfortable. So those are typically, when you see these patients, it can be quite overwhelming for someone who's not used to that kind of environment, because they'll have a lot of different lines and supportive devices that are kind of keeping them safe.
Sure. Now, is that like an induced coma? Is that pretty much what that means?
Yes. So for lack of a better term, so intubation is when they're, they require respiratory care, and then the medications that we give in order to safely manage the process of intubation and mechanical ventilation via the respirator is essentially putting people into a coma. And then the process for bringing people out of that after they have been on that for several weeks is a whole nother difficult process to manage.
Mm-hmm.
And the reason why people would be intubated is if they are declining because of an illness that is essentially telling their body that they are not able to breathe on their own, which is kind of like the most basic instinct that we have. Breath is life. So once your body's no longer able to ventilate, you're not able to really support your life anymore. So it is an emergent and very life-saving procedure that has to happen in order to keep people alive when the virus has taken such a toll on their body that they are no longer able to do that for themselves.
Sure. So, we're hearing again on the news, whatever we want to choose to believe, that a lot of the hospitals are mostly ICU units at this point. Is that really the case?
So it's difficult for me to say. I don't necessarily want to, make statements that I can't verify or fully, support. But I will say that, for example, the hospital for special surgery where I work did not have a traditional ICU, and we literally created one.
Wow.
Like I said, in 2 days to take the volume, to be able to support the volume of patients that were coming into other institutions that could not handle that because they did not simply have enough beds. Patients who are COVID positive and are in ICUs are needing to be isolated. So one of the, and I definitely would love to touch on this at some point during this interview, one of the things that's so important for people who have this disease and also for the healthcare workers who are taking care of them is that they are in a room that is completely separate from any other, so patients who have COVID can be put in a room together, depending on, that's not ideal, but it does happen. But the important thing is that they need to be in a room with a closed door, and very, very specific things need to take place as far as medical personal protective equipment, which is probably something that everyone's familiar with hearing, at least, that the healthcare provider puts on and off in order to prevent contaminating themselves and then potentially contaminating other people, other patients who maybe are not COVID positive, and then also colleagues and themselves. So typically they do try to keep ICUs that are created as such, like what HSS did, separate from the rest of the hospital. So we have had created this ICU that is only for COVID positive patients. And then I know other institutions that have done so have also, made attempts to the best of their abilities to keep the patients who are COVID positive separate from the rest of the patients who are maybe in ICU for other reasons. Also, I know they've opened up additional facilities, not only just creating more beds in existing institutions, but like the Javits Center and places where they've been able to, or the naval ship, they've been able to repurpose spaces that weren't previously for this purpose to create beds so that patients who did need to go there would have a place to go that they'd be able to be safely cared for.
Right. Now, when you say they built this ICU in 2 days and then enough to handle the incoming stream, what was that like? What kind of volume?
So the ICU that was built was essentially fashioned out of because HSS has several operating rooms or operating departments, I should say, and PACUs. So they took the ORs that were used for operations and that had doors on them because of the sterile procedures necessary for performing surgery, and made those into rooms for patients to be cared for. And then they created a whole system. It's pretty incredible, actually, a whole system that involved coming in from one side of the room as a clean side, and then doing the care that's needed for the patients in that space, and then entering on another side, which was essentially another access point for the operating room that became the dirty side, or the place where you would take off your personal protective equipment, cleanse yourself before coming back to the clean area in order to interact with colleagues and do what you needed to do outside of the room safely and without contamination.
Yeah. You're describing a science fiction movie. You do know that. That's what it sounds like to us. That is just crazy. It's just amazing.
It's crazy. It's amazing. It's I have to say it's pretty phenomenal to be a part of the process from a healthcare perspective, to watch this all unfold as it has in real time, and to see the response that people have. And we've had companies and businesses delivering food to us, so that, that's an incredible initiative that people just do just because they want to help. And
Sure.
Have nurses like myself who had not worked in an ICU role before, who were essentially overnight, facing the reality of needing to step into this role that's very new and that would normally require extensive training. And so that was pretty, I have to say, it took a lot of support from my colleagues, and also just faith in the process and in my medical knowledge, and a lot of just looking up, YouTube videos, looking at articles, having colleagues send me things that,
Wow.
read up on this before you take a patient on a ventilator, because, those were not things that I was necessarily taught in like a traditional framework.
Sure.
So it was definitely a lot, but I was ready. This is a vocation, this is a calling for me, and for the people that I work with. So whatever is necessary, we will do. We won't stop.
Yeah.
We'll keep going as long and hard as we can.
You've always been trained as a nurse, schooling and everything, and all your past experience, and then you're just describing what you had to do above and beyond to be prepared for this ICU stuff. Talk to us for a minute about fear. Does it exist for you and the other nurses, and how do you deal with that?
It absolutely does. I don't know, there's this great quote. I think it was from like Game of Thrones. I don't even know where it came from, but there was this quote that I kind of like reflect on. That's, that being afraid, or being brave is only possible when you are afraid. So, that's true for anything. And there's a sense of fear. I wouldn't call it desperation. I would call it a respect and an awareness that you have as a healthcare professional for how devastating this is on a social level, and also on a personal level for patients and for healthcare workers. And you really respond to that by relying on your community. Like I said, I've reached out to, and I've developed relationships with my colleagues and nurses near and far from me that have been like lifelines for me going through this process. And it's not just necessarily the news that you aren't able to rely on. It's everything, because this is all happening right now, and the data and the research is not there.
Right.
Yet. So a lot of what we're doing is anecdotal, and it's not what we're doing, but a lot of the types of treatments and things that we're trying are really new, and we're not sure exactly the best way to move forward in every circumstance, but we're sharing, and we're erring on the side of caution. And it's like, as soon as one thing comes out, an article saying like, this is the answer, there's another article that comes out a day later saying that was not the right thing to do. Like, this is now the right thing to do. So a lot of it is just, a colleague of mine said recently, or sent me an article that kind of said, sometimes the best way to move forward in a situation where there's so much uncertainty is to just, think about what you would do if there wasn't the COVID. If COVID didn't exist, what would you do for this patient? What would you be doing, medically speaking, to address the needs and to care for and to attempt to treat? And sometimes those are the best ways to, because there can be a sense of despair if there's not one solution. What do? We right. do what we think is best, regardless of whether, or not this existed in the grand scheme of things. That's how we take care of people.
Wow. So you talked about outreach, that people have been sending food and such to the hospitals, which is great. And we hope that's happening. We've been trying to support our local hospitals around here, Sanford and Norwalk. Tell me a little bit about your days, your shifts. Are you working full shifts? Is it more than before? When do you go home?
Well, so this is an interesting topic, actually, and this is I work a full schedule. Right now, staffing at my particular institution is good, and we have the support that we need. I think that HSS has done a really good job of trying to set in place a lot of support for their staff members, and they have been doing everything they can to give us the resources that we need to be safe and to care for people in a way that's protecting ourselves as well as providing the best possible care to the patients in the ICU and for the rest of the hospital. So I have been self-quarantining to an extent. I live in Connecticut. I live in Norwalk as of 3 years ago. That's where I have my home and my spouse. And I have been, since working in the city, I've been primarily living in a separate apartment that is attached to my parents' home in New York City, because I don't want to risk contaminating or infecting or spreading the illness to my family in my home and in my community. So to the extent that I can keep myself separate, I do. And a lot of healthcare workers are doing that, especially, you know, people who have immunocompromised family members, small children, even spouses. You know, a lot of the doctors and nurses that I work with are living in their basement, and their families don't see them at all, don't interact with them. And that's what we have to do to keep the people that we love safe while we care for the patients that need the care.
Sure. Like Chris Cuomo on CNN. He's been broadcasting from his basement for weeks since he's been positive. So do they test you daily? How often are you tested, and how does that all work?
Yeah, so testing, that's a fascinating question. So initially when this came on the scene, I was working in the emergency department, as I told you, and the testing was taking, I mean, it was taking days to get tests back for patients who were symptomatic. So the way that it would work would be people would come in with symptoms that were suspected COVID, and we would need to rule them out, and we would take chest x-rays, chest CTs, because the respiratory system is one of the best indicators of trying to find out, absent of a test that can tell you right away whether someone has the virus or not, whether or not they're likely infected with it. But the tests that were being sent out were being sent, I believe, to Albany or Utah. There was like one place that was doing these tests, and it was taking days for them to come back. Yep. So there was really no way to tell right away if somebody did or didn't have COVID-19. And so we were just doing our best to try to assume that kind of everybody did have it and go from there, right? So no matter how you presented to the emergency department, whether it was a car accident or whatever, you were just cared for as though you were potentially infected, because there was no way of telling quickly whether or not a patient was. There is still, so now testing has become much more fast, quick, and accessible to people who are showing symptoms. The turnaround is quicker. However, I have a colleague who had waited days for a test, and not at my institution, at a different institution. They're not testing people who aren't symptomatic. So right now, I have not been symptomatic, so I've not been tested. And so you kind of operate and care for people as best you can, sort of personally assuming responsibility for potentially being a vector or being sick by isolating yourself from your family. However, when you're going into work, you are not being tested on a daily basis. One of the ways that some institutions are trying to figure out a roundabout way to deal with that problem is by taking their staff's temperature every day to see if they're febrile, because that's one of the quick indicators. But that's not necessarily the only indicator of whether or not you're sick. So it's still a huge issue. Testing being available to healthcare providers and just to the general public is something that I think will need to be continually addressed and worked on in a way that makes more sense. Sure.
So a little bit of a lighter note, I guess. Can you see a light at the end of the tunnel yet? Do you see admissions slowing down?
Yes, tentatively speaking, I will say, I think at least, like, I'm not huge on the news. Like I try my best, I was listening to Andrew Cuomo's, daily updates for a while, just to kind of like get a sense of like the numbers, and then also looking at the data on my own from different websites to try to see, where we were headed. But there was a lot of talk about there being a peak of like the maximum amount of cases that we were going to see at a time, and then that there has been a shift so that things were kind of going up like this, and then now that it's expected that we're kind of going like this. And what I'll say to that is like I think that to the extent that that's a reflection of community members and people's willingness to continue to stay safe for as long as it's necessary to really try to get to a safe place where we are, as a society, able to interact with each other. I think that's important. People need to continue with the social distancing until it's clear that that the threat has passed, in the sense that people can safely interact with their communities. It's so important. It's so necessary. And I know that it's been a long time, but when people realize that by interacting with others, you're potentially increasing your risk for spreading this, and also increasing the burden on the healthcare system. It's
Definitely.
just the best and safest and only way to get through this is to continue to remain socially distanced from everyone.
Does it make sense to say we need to do that until there is an effective vaccine?
I mean, the problem is an effective vaccine, it takes time. All of this takes time. So research, data, there are so many companies working around the clock. I have a friend who's at one company who is like, they're just putting all the wheels in motion to try to come up with something. But a vaccine can take upwards of a year to more to come up with, because it just requires so much detailed scientific
testing,
analysis, and research.
Yeah.
And it's not necessarily, I don't think that there'll be a need to remain completely isolated for another year. I hope not. But herd immunity and stuff like that is just socially the only way to really make sure that you're safe, is that you just, to the best of your ability, limit your interactions. And when you do have to go out, and when you do have to do things, take the necessary precautions, gloves and a simple mask. I have some equipment here. I don't know if that's something that you'd want me to do, is kind of like go through the different pieces of personal protective equipment, not just from a healthcare worker's perspective, but from anyone's perspective, for like what, kind of you'll see people doing and what would be a good idea to do if you were to go out to the grocery store. Like a simple mask will protect to a certain extent, keeping the distance of the 6+ feet as best you can from people around you. We all have to go out to get food, to get, toilet paper, to get necessities that we need to be able to stay home and
Sure.
continue to be responsible. But a mask like this, well, you can just, and then you can wear gloves, use a barrier of some sort.
Mm-hmm.
And this will at least protect you and others to a certain extent.
Sure.
Plus maintaining that 6 feet. Those are the best things that we can possibly do right now.
Yeah, absolutely. I think we're all abiding with that. I think pretty much I've seen a lot of these people come to the office to get their masks and gloves, so they're doing that. Yes.
Good job, everybody. Well done.
Yeah. Can you share with us, one thing right now that all healthcare workers need, aside from our prayers and our thoughts, is what can we do?
I think honestly, just the show of support and compassion and community is so important. This battle, letting the healthcare workers in your life, and that know that you are with them in spirit and thought, and that you support them. Just reaching out to your loved ones who either are healthcare providers or no healthcare providers, and just asking that question: what can I do? What can I do? If you're working a 12-hour shift, like send food, or whatever. I had a friend send me a little care package with like a bubble bath thing, and that was like the sweetest, most wonderful thing that she could have done. She lives in North Carolina, and she just had, the internet is a wonderful thing. You can send all kinds of stuff. You can text, you can, put a call out. Everybody wants to know that their loved ones are thinking of them and are supporting them from a distance. Also, just continuing to abide by social distancing until it is safe to go outside. That is probably the number one thing that you can do to show love and support for healthcare providers in your community and in your life, because every person that goes out unnecessarily represents an imminently larger number of people that are going to end up potentially getting ill and showing up in the emergency department, which will overwhelm the system. So sure. I was telling all the people in my life, for that period of time where it was just the numbers were getting scary, and there was just really a sense of real anxiety about where this was headed. Every time you leave the house for something that you really don't absolutely need, I want you to think of me, and I want you to think of my life and of what I'm trying to do, and that equals 10 more people coming into the ER, or another patient coming into my ICU. Sure. Literally that kind of a numbers game to a certain extent.
Right. No, I think that's really profound. That makes sense. That's the perfect thing we can keep in mind. Make sure that we do keep that distance. So tell me again, on a lighter note, who have you seen recover, and how amazing is that? And just talk about that.
I mean, the thing that is so heart-lifting and soul-lifting to know is that, like, so many people, so the majority of people do recover safely and don't require hospitalization. So I have colleagues who have gotten sick, nurse friends, and they haven't had to go to the emergency room and have not had to go into to be admitted to the hospital. They've been able to safely manage their symptoms at home. People tend to decline quickly. The symptoms that you have can be incredibly scary and distressing as far as the breathing. So just trying to stay calm and not go unless you need to go to the emergency room was something that my colleagues who have been diagnosed with COVID and who have recovered at home have said, it's scary. But, I knew that as long as I was able to continue to breathe and to meditate and stay present, that was something that, was good. As far as the positive stories, I mean, it's just, the ICUs is a really scary place because a lot of the patients are extremely sick. But you do have stories of people who make incredible, remarkable, miraculous recoveries. Not all the time, not every day, but it does happen, and it's always something to be celebrated. I have had patients who have, been able to come out from the induced coma, have been able to come off the respirator. It's not, it doesn't happen frequently, at least not to this point, because it is such a life-threatening illness, and by the time that a patient gets to the ICU, they are already very sick. Mm-hmm. But it is something that we see and something that we fight for and work for tirelessly. And our medical providers at HSS, the anesthesiologists and the nurses, we do everything and anything that we can to try to facilitate recovery, even sure. Even when it's looking scary. But the majority of people do get better. And that's something to keep in mind. It's you always hear about the number of fatalities, and that is a scary and true reality. But it's also so important to remember that that most people are able to come through this safely And then, you know, there's a lot of initiatives going on now with donation of plasma of people who have recovered, who have, you know, become stable enough that they can now go and donate plasma. And that's one of the treatments that is being attempted right now. So
cool.
infusions of plasma from people who have recovered and have antibodies to the virus now.
Right. Yeah. That's a huge leap forward. That's great.
Yeah, it's amazing.
My hat's off to all of you, because you're not only their nurse, their healthcare provider for these people in the ICU, but you're their human contact. You're their family. You're everything to them, and that is just incredible. It's just amazing to me what you're doing.
Thank you so much. I will say that is one of the harder things about this disease is, you know, normally when people are hospitalized and who are really ill, you know, they're able to have family present, and with COVID and the restrictions that are necessary to keep everyone safe, one of the hardest things is that people can't have their families there. Right. So it's an incredibly meaningful and powerful thing to know that that you're everything to these patients.
Absolutely.
And we can always use, you know, we use FaceTime, we use tablets, we use ways to, you know, interact with family members and bring them to the bedside virtually, just like I'm doing right now with you,
right.
Everybody here. So there are ways to, you know, communicate. Thank God we live in this modern day with technology available that we can stay connected physically, at least, you know, face to face with our family and loved ones. But as far as a physical presence, being there and being able to hold, you know, someone's hand, that's at the end of the day one of the most meaningful things to me is reflecting on that.
Sure. I am almost speechless. I'm just so impressed and so respectful of what you're doing, and I appreciate you taking this time. Are you home now?
Yeah, I am in my little studio in New York City. I worked last night. I worked Saturday and Sunday night, and I have a day or two off, and then I go back for another 3 days towards the end of the week for more work. So yeah, I think I am home too. I'm home in my home away from home right now.
Right.
And trying my best to, you know, just
one day at a time.
One day at a time for all of us. For all of us, yeah.
So can I open it up, Alessandra? See if anybody has a question for you.
Absolutely, absolutely.
So anybody, you can unmute yourself and please feel free to ask Alessandra anything, or say something.
How is it? Oh.
I'm just going to say thank you for everything you do. Really appreciate it. And thank you for enlightening us. I had a question. Are there different strains? You know, you hear somebody that's healthy that didn't make it, and then you hear somebody that might have had otherwise compromising circumstance have made it. Is there different strains? Is it more luck of the draw, or it's just one type and it's just? So
I have heard I've heard different things about that. I initially, when this came on, there was a lot of talk about, you know, viruses are living diseases. So what they do is they mutate. And that's why they can be so difficult to treat and to defeat, is because they essentially attack your immune system using your own body.
What he said is front and rear brakes.
Take care of it.
They're going to change the road.
Somebody else speaking?
Go ahead. I fixed it.
Oh, okay. So, you know, one of the scariest things about COVID is that there are people who are healthy, and you don't necessarily understand why they are hit so hard by this. And then, you know, a weakened immune system is always going to be putting you at a higher risk level. But one of the really scary things is that we don't necessarily understand so much about this illness, and there's not a concrete answer as to why some people who are otherwise healthy get sick and why some don't. it's not clear yet.
Mm.
And that's one of the most distressing things right now, is that we don't have those answers yet. Yeah, I mean, I think that's the best way that I can answer that question.
Sure. Anybody else?
How is,
Sorry, go ahead, Fiona, you go first.
Go ahead, Fiona.
hello, sorry, technical issues. Thank you for all that you're doing for us. I have just a personal question about how it is being in New York right now. Just, are you like downtown, or where are you, just roughly, just to understand that?
So the hospital where I work is on the Upper East Side, and my parents' home is in the Bronx. So that's my area right now, is going between those two places. And it's pretty, I mean, several weeks ago I could safely describe it as a ghost town. There was really nobody out and about, and I was like, yay, that's good. But it's definitely, there's been an uptick in movement, just even cars on the road that I've noticed while I'm going to and from work. There have been more people outside. As the time has gone on, it gets harder, which I recognize, to stay indoors, especially as the weather's getting nicer. Everyone wants to be out when it's a beautiful day. But it's definitely, it's the volume of people out is significantly decreased. And New York is almost in some ways unrecognizable to me, having grown up in New York City and worked here my entire adult life.
Yeah. Who else was trying? Oh, Alice.
Yeah, I was. I just wanted to ask, if somebody has been intubated and they do recover, are their lungs forever damaged and make them more susceptible to other illnesses?
So that is, I don't know that it necessarily would make, I don't know, I'm not sure that I can really honestly answer that question 100% accurately, like I said, because we haven't been able to study the respiratory systems of patients who have recovered for a long enough amount of time that we can make that kind of blanket statement. But I will say that although this disease does primarily affect the respiratory system, it affects, in a lot of cases, it affects much more than that for patients who are critically ill in the ICU. So a lot of different systems are being pulled into this once the patient who gets sick enough that they require intubation and require ICU care. The recovery for people who are able to be extubated, which is the process of removing the breathing tube, it seems to me to be a very long road. Obviously different for every single person, and every single case is not going to be textbook. There is no textbook for this at all. But it's certainly not like you get extubated and then there are no long-term ramifications. I would certainly not think that would be the case for almost anybody.
Right.
Thank you very much, and thank you for all you do for us. We'll
Absolutely.
be praying for you.
Thank you.
Thank you for sharing with us.
Absolutely.
Absolutely. Yeah.
It's a pleasure.
I had two clients that lost their parents to this COVID. They had a lot of underlying other health situations. They were both at Stamford Hospital, and one was buried yesterday and one the day before. So it's so sad that they were much older also. But I think it's really took a toll. One was diabetic. I didn't find out about that, and had high blood pressure also. So I think with the older patients, when they have a lot of underlying health situation, they didn't recover. They were on the ventilator and everything. So it's really sad, and it was just so, I felt so, just wanted to try to help and see how best can we continue sending stuff for you, the nurses, and whatever we need to do to help out at the hospital.
Absolutely. I mean, I thank you so much, and I'm so sorry to hear. I think everybody that I know at least has been personally affected by this at this point. It's on that kind of a scale and the volume of what we're seeing. You know, I don't really know anybody who hasn't known someone who's been sick. And absolutely, every single initiative that anyone comes up with is so appreciated. I mean, from the food deliveries to the people who are making masks, you know, with their sewing machines at home, using donated fabrics from like Joann's, to, you know, the companies that are giving healthcare providers discounts, like all that matters so much. And all the support and love in the community is ultimately, you know, it's a constant reminder of what it is that we're all fighting for collectively. And then for frontline workers, you know, what it is that you're putting your life on the line for is for the people that you love and for the communities that you're a part of.
Sure.
I have a question.
Go ahead.
Alessandra, can you give us a tip when we, as a realtor, going showing homes or, you know, going to a, you know, just when we going show, you know, going show homes, what would be the best for us besides wearing gloves and masks? What other precautions can we take when we get home and, you know, to take care for our loved ones as well?
Okay, so I would say, you know, it's going back to the basics. You know, the hand washing is absolutely key, and not touching the face. You know, not touching the face. So the masks and the gloves, keeping the distance when you're showing clients, when you're interacting with anyone, whether it's signing papers. You know, you send those papers down the table. Keep that absolute 6 feet. Wear a mask, wear gloves, and then always wash your hands as though it was your like full-time job. You know, just any time and every time, carry the hand sanitizer if you have access to it. If you're coming into your home from off the street, I would say the best thing to do, and what I do no matter where I go, is immediately take off your clothes, jump in the shower, clean clothes, and then put the clothes that you were, you know, out and about in a plastic bag straight into the laundry or into a pile where you would put in the laundry. Just like think about just what you know, how illness is spread, and just make sure that you're taking the precautions that make sense. That, you know, that's the best way to keep your loved ones and yourself safe. You know, in addition to the masks and the gloves and the hand washing, just the constant hygiene. It's a hygiene practice ultimately at the end of the day. Even when you're like bringing food in from out of the home, you know, washing it down, taking Clorox wipes, washing down just things that you touch on a regular basis, keys, doorknobs, handles, you know, kitchen appliances. If you are leaving your home and coming back in for whatever reason, you know, just making sure that you're washing down the surfaces that you're touching continuously. That's the best way that you can protect yourself and your family.
One more question. How about your hair? How do you protect your hair?
So I mean, for me, I have long hair, and I was going to get a cut right before all this happened, but yeah, good luck, Charlie, now. So I as a nurse in the hospital system, like I pull my hair back tightly into, you know, a bun. And then when I go to work, I have a surgical cap that I, you know, put on and tie here so that my hair is constantly, you know, covered. And then when I'm going into patient rooms, you know, patients who are positive, you put on additional, you know, stuff like this that will, like, in addition to that, cover you. So I would say for you know, if you're just going out of the house, if you want, you can wear a hat. You can wear, you know, a bandana over your hair. If you have long hair, just tie it up. And then, you know, wash it as often as you can. I mean, it's hard for women with long hair, believe me, I understand, to wash it every single time you leave and come from the house. But at least covering it, if you can't wash it, if you don't have the texture hair that will be able to tolerate washing multiple times a day or however often you have to leave, just covering it and keeping it, you know, covered. And then, you know, whatever kind of hair cover you use, just in the laundry basket with all the other clothes, just treat it as another piece of clothing.
Thank you.
You're welcome.
It's a good question. I never would have thought about that. Tell you, you're going shopping and coming home with a carload of Costco takes on a whole new meaning when you have to wipe everything down. It's just, Takes some
Yes,
time. Yes.
it
Yeah.
sure does.
Alessandra, I have a question. Thank you so much for everything that you're doing for us. We really much appreciate it so much. We are still showing homes, as you know, but I would really love to know, because not a lot of talk about what the patients that are not getting to the hospital, how do they deal with it, the symptoms of COVID at home. And I think that many of them are trying not to go to the hospital. But I'm sure many of them have symptoms, just like you said, a lot of your colleagues probably do. Can you talk to us a little bit about, how these people have been managing their symptoms back at home?
I mean, to be honest, I've been so focused on the hospital experience that all I can really share is just what I've been, what I've heard from and what I've spoken about with my friends and colleagues who have been sick, who have been confirmed positive, haven't gone to the hospital. So like I have one colleague that she got sick. She was exposed at some point, most likely at work, because she, like myself, began working in a COVID ICU once this happened. She has a little boy, and she did have some pretty severe respiratory symptoms. And it was a real scary decision for her to stay home and to not go into the hospital. But I think if you are home, you should keep in mind that if symptoms worsen suddenly, especially respiratory wise, if you develop new shortness of breath, or if it increases dramatically, if you're spiking an extremely high fever, then those are indications that you need to go to an emergency room and get another level of treatment. If you are kind of ill with symptoms, but they're kind of feeling as though it was just a really bad flu, then from what I've been told, again, I've been so blessed, thank God, that I've not had symptoms. But from what I've been told by my colleagues, it feels like a really bad, icky, awful, terrible flu. And they've been able to just stay home and, take Tylenol for the fevers and, just treat it as though it were, just that, like a really bad flu. And as long as they, haven't been having difficulty with breathing, they've been able to safely stay home and recover, outside of the hospital. I think it's scary, and I think it's just making sure you check in with people. So if you know someone who is sick and they have not gone to the hospital, just checking in with them. How are you feeling today? Have things gotten worse? Have you had any new concerning symptoms? Because generally speaking, I think people, when the breathing gets difficult, there's an indication that you're going to need to go to get some help regardless. But yeah, I think it can be managed safely at home if your symptoms are not severe respiratory symptoms.
Thank you so much. I have one more question. I know that this is sort of a question mark for a lot of people out there, but I have had already been showing homes to people that I know have tested positive about a month and a half ago, maybe. How long, and everybody was protected, of course, how long after they get their positive tests are they actually contagious for? Does anybody know an answer to this?
I mean, right now, and if I don't answer questions specifically, it's not because I'm trying to be evasive, it's just because I don't want to misinform anybody. That would be the last thing I want to do. So I'll answer anything to the best of my ability, but I don't want to, spread information that I'm not 100% sure is accurate. And the problem is that none of us really know 100% right now about so much about this. But what they're telling healthcare workers right now, the guidelines are that if you've been afebrile for several days, and if you haven't had symptoms for several days, that you could potentially come back to work. They're in the hospital. The way that we can tell if someone's recovered, I guess, is by doing the nasal swab, which is the test for COVID. So if you have a swab and it's positive, a certain amount of time has passed, you've received treatment, your symptoms have been managed and have gone away, and then a subsequent swab will be done to basically determine whether you are still or are not positive. That is to say, whether the virus is still active in your body and whether you are still contagious. So short of having a second swab done to like 100% know that you don't have the virus or a viral load in your body, I think it's just several, so I would say erring on the side of caution is always best. So several days after you've had no symptoms at all, and then just, continuing to practice the hygiene and the mask wearing and the glove wearing and whatever kind of protective equipment that you have to just, maintain your own space and your own distance.
Well, I have a quick question. So I've heard some confusion about, the definition of asymptomatic. So does that mean that you're not exhibiting any of these symptoms and yet you're positive, and that you just haven't gotten sick yet? Or you may be positive, but you never exhibit, you never get sick?
Right. So that's an excellent question. So asymptomatic is exactly the second as what you said. So asymptomatic would not mean, so there's a point at which you become infected and you don't have symptoms yet. That's like an incubation period is what they call it. So you've been exposed, you are infected, but you don't actually start showing symptoms for whatever it is. I think they're anticipating it could be up to like 2 weeks potentially that you could be infected and not know it. For this particular disease, it varies depending, on the person or whatever. And also the disease, different diseases have different incubation periods. But there is also the possibility in any kind of virus or infection that you could be asymptomatic, which essentially means you are it's possible for you to transmit it, but you don't have symptoms yourself. And that just is a person by person case. Sometimes certain people's immune systems, for whatever reason, have certain built-in ways of protecting that person. Others don't, which is why you see such a gradient in the level of care that people require when they are ill. Some people succumb and some people don't. So asymptomatic would mean that you could potentially be a vector for this disease, which is, healthcare providers, myself included, like one of the scariest things is, even if I feel fine because I'm young and I'm healthy and for whatever reason my body, let's say I could have been exposed and not know it, I don't want to go home and interact with people and potentially put them at risk, because you don't know the people in your lives, their immune system isn't your immune system.
Right.
So that's kind of, it is possible to be asymptomatic, or even just have very mild symptoms and just think it's like a cold.
Right.
Just depends on the person.
Right. Got it. Thank you. Anybody else for Alessandra? We've taken an hour of your time, Alessandra. Never expected to do that. Thank you so much. Anybody else? Quick question. So I'd like to unmute everybody, and I'd like us to give a standing ovation to Alessandra for what she is doing. Mm-hmm. And for everything that she shared with us. I'm not kidding.
So much, everybody.
Thank you. Thank you.
Thank you so much. Thank you so much, Alessandra. Keep fighting.
Love and gratitude, everybody. Love and gratitude.
So do you hear in New York, do you hear the 7 o'clock thingy going on when you're there?
Yeah, I do. Yeah, it's
awesome.
Amazing. It's amazing.
Great. That's great. Well, listen, be safe, be healthy. We love you here at KK.
Okay. Yeah, now everything is like closed, so only drive. Yeah.
Thank you so much, Alessandra.
Thank you.
Bye,
Thank
guys.
you.
Stay safe.
Thank
You too.
Bye-bye.
Thank you. Be healthy.
Thank you.
You too.